And so the title of this talk is going to be Medical Morbidity in Patients with Serious Mental Illness. Do they have to die young? No disclosures for this talk. The learning objectives are to define severe and serious mental illness, identify qualifying diagnoses, describe the relationship between schizophrenia and mortality risk, explain some reasons for increased mortality in people with schizophrenia, and identify an intervention to potentially decrease mortality risk in people with schizophrenia. So not just what's the problem, but is there anything that we can potentially do about it? So what is serious mental illness? Well, you heard a bit about this from Gabby and Vicky, but there are multiple definitions of serious mental illness, and in fact, these differ from state to state and even from insurance company to insurance company to try to get people qualified for various services that might come along with having a serious mental illness. So this is the NIMH definition of serious mental illness, a mental, behavioral, or emotional disorder resulting in serious functional impairment which substantially interferes with or limits one or more major life activities. The burden of mental illness is particularly concentrated among this population of patients who experience disability due to serious mental illness. The most common diagnoses that fit into this category are schizophrenia, severe bipolar disorder, and severe major depression. But as you saw on Gabby's slide, there are a number of other diagnoses that may qualify people under certain circumstances. There are many challenges to studying serious mental illness and to interpreting the literature with regard to serious mental illness, and that includes the extremely variable presentation between the illness groups. So someone with severe major depression does not necessarily present the same way or have the same challenges as someone with severe schizophrenia. Morbidity and mortality are also not the same between these groups. There are differences in the challenges that people face with their medical comorbidities and overall mortality between people, for example, with, again, severe major depression and schizophrenia. Additionally, as I said, the causes are different. There are also differences between healthcare systems. And the healthcare system that is involved with one patient may not be the same as with another. Insurance coverage may be different. The availability of resources for certain populations may be different depending on the healthcare system that they're involved in, and also between countries. So the United States may have a different way of managing situations with serious mental illness than countries that have a universal healthcare system, for example. And I'm going to focus largely on the United States, but I will give you a little bit of information about some other countries as well. So I would like to propose in this talk to use schizophrenia as the paradigm for severe